CommHIT.
All right, so people are always asking me, what do you guys actually do? Because people are like, we know you do a lot of stuff. We hear about you. We hear your name like in different circles, in different communities, but what is it that you do? And you know, why are you interested in space? So we're a 501c3, and we focus on the discovery of processes and technologies that deal with the remote care of people. So anything that's a gap, anything that needs to be better connected, fragmented systems, especially those that deal with community, with technology, just the care of people, those are the kind of spaces that we operate in. We're at the Space Center because we work on Earth, but things that we do, especially in these resource-poor areas or in remote areas, it really informs what happens with space habitation. How do you set up communities or training for individuals and a knowledge base with them to where they're able to care for people in space? Because you don't have a specialist to go to, you know, at least not, it's going to be limited in terms of your specialist. So our mission is to increase community health, develop workforce, and also improve lives by planning and operationalizing complex programs, ones that combine community, technology, and health. And as we do that, especially in areas that are rural, resource poor, or otherwise remote. And our vision is really to create a strong, flexible technology and healthcare workforce that serves our communities day to day and in public health emergencies. We saw what happened with the COVID pandemic. We were not ready for that with a broken healthcare system. We knew that there were problems with the healthcare system, but we really got to see what the problems were with healthcare once COVID hit. So what we try to do is make sure that there are resilient systems in place that are low cost and can be done in resource poor areas as well as urban areas. We're located here. This is our headquarters at Kennedy Space Center here in the Astronauts Memorial Foundation. We also have a site in U.S. Virgin Islands on St. Croix and one in Flagstaff, Arizona. And then our reach is 48 states, DC, and 4 of the 5 major US territories. And this map here is showing you one project that we work on with PACOM, where we reached out to these communities to get them credentialed with the HIT CMPP. So we also help rural medical facilities with getting funds back for their broadband expenses so they can put more money into either broadband connectivity, expansion of that, or if there's any operational needs that they have for their organizations to take better care of those who are in rural areas. Since 2014, we've recouped $18 million in expenses from the FCC for rural health organizations in these 10 states. And as I mentioned earlier, one of the biggest things that we do, probably I would say it's the cornerstone of our work, is workforce development. We have 3 federal grants that help us with that. And what we typically target is locations of concern. Again, going back to the resource poor, rural, remote, workforce pipeline. So how do you get people into a certain type of occupation or sector and make sure that they stay in that sector as needed? We look into untapped talent pools because it's really important to make sure that you understand that when you have a workforce shortage, it may be that you can just look around in your community and set up a program to where people are going into that particular line of work that you need, and it supports the economic development of the community as well. Something that I learned from the Florida Center for Nursing director, Dr. Reina Letourneau, who is here with us today somewhere. There she is, right in the front. So she taught me about transition shock. So what happens when somebody goes from training, especially in nursing, into the workforce, and how that can be so jarring to them that they actually leave nursing, which adds to our shortage issue because that person just trained, they gave up hours of their lives, years of their lives. They're doing something that they thought that they would love, and then they had to get out of it. It doesn't help anybody in the system. So we try to make sure that we're easing that transition from training into the workforce. Also, stackable credentials are very important to us because we want people to get increased pay and also do increased quality work. Quality work, that's very important. And the last thing, of course, especially with us being in the second space age, evolving occupations. Needs change, technology changes, things are always changing. We want to make sure that how people are trained, what they do, that they can change and adapt, and we're able to provide training and put them into occupations to move forward with. We do work in cybersecurity. So Dr. Willis and I, Dr. David Willis, he's the co-founder of CommHIT, and the reason why, and he's right here in the front here, and he's a little shy, so, you know, make sure you talk to him today. He's not. We started the first rurally based health information exchange in the nation. So that's where doctors can get patient information, needed patient information, having that in one place for the patient, and then being able to send them on to specialists or to other type services that they need, even if it's a hospital in the urban center. And one of the first things we found was, of course, people needed to be trained on the technology, but the cybersecurity was terrible in some of the rural areas. They didn't have the resources for it. They didn't really have what they needed for health information exchange. So it was hard to connect rural areas to the hospitals and the urban centers, because the rural areas then became the vulnerable link to basically the safety of that patient data. So we had to concentrate a lot on cybersecurity pretty much immediately after we operationalized. So at this point, we have an information sharing and analysis center. I did not name that. That was named by an executive order. It's called an ISAC. But we have that in place, so there is threat monitoring, block lists, and assistance with incident response if any health organizations need help with that. It is free for health-related organizations, and we're just here to make sure that we're helping manage people's risk, because cyber safety is patient safety. One of our other services that's important, also near and dear to my heart, is our evidence-based transportation. We started that, actually, Kevin Salser, who's our Chief Technology Officer, he specializes in transportation. He and I came up with a model in 2014 to use community health workers for transportation. And, you know, it's more detailed than what I'm saying right now, but that's the basic of it. And we never had an opportunity to try that model until COVID. And when COVID happened, University of Florida, they started the infusion centers, and they started doing them across the state. But those who were in rural areas with moderate COVID that didn't have access to a hospital because the hospitals were full, if they could only get to the infusion centers, then they would feel better. I come with a microbiology background, so my PhD was in microbiology and cell science, and we were able to make sure that we had sanitation policies set up, sanitation process set up very quickly, and started transporting rural residents with COVID before people really knew what was going on. So now this has evolved where we do transportation for patients with cancer that need to get to treatment or they need to get to research at University of Florida. We do other things as well with the transportation, but that's our main item right now.
CommHIT.